Hi everyone, I'm Brigid Titegmeier, a functional medicine dietitian.
Is that how you
and
say
the
your name?
nutritionist. Yes.
I had no idea.
And the nutritionist for TownHall. I'm here with a very special person, Dr. Mark Hyman. Hi.
Hi.
He's the center director for the Cleveland Clinic Center for Functional Medicine. He's the founder and the medical director of the UltraWellness Center. I have your whole bio memorized almost.
Good for you.
And the chairman on the board of the Institute for Functional Medicine. He's a 11-time number one New York Times bestselling author. I am always one behind. And also the host of the Doctor's Pharmacy podcast. He's a medical contributor to the Huffington Post, the Dr. Oz Show, CNN, Good Morning America, Katie, and many others. So he has a pretty impressive bio that actually is much longer than what I just shared. Thank you for being here.
Thanks for having me.
Yeah. So it's funny that we're sitting here at the Center for Functional Medicine, this beautiful 18,000 square foot floor of the Cleveland Clinic, and you're doing amazing things. You're saving thousands of lives every year with the large medical team that he has. I wanted to start by just going back to 2014, which was when our paths first crossed, and talk about where the center was then compared to where it is now, because it was a very transformative thing for Dr. Hyman to come here and to start the first center for functional medicine that exists only at the Cleveland Clinic in the entire world, and all that you have gone through, that we went through the process of really changing healthcare. So if you could talk about where we were, like in the basement, right down the hall from McDonald's, in a hallway pretty much, compared to now being in this 18,000 square foot
Yeah, we had a tiny
space.
Little space. It was kind of disjointed. It was in the employee wellness clinic.
Walk-in clinic. All the functional medicine patients were upset that they were with all the sick employees in the waiting room.
Yeah, all the sneezing, coughing employees.
Yeah.
And we were right down the hall from McDonald's. Starbucks was right outside our door.
People were fasting and to get their labs done, and then smelling McDonald's, and we're saying don't eat fast food.
We had no idea what was going to happen, because it was a total experiment. Toby Cosgrove invited me to come build a center here and said, you need to create a vision and strategy, and I'll put the operations and the money behind it. And he was true to his word. And we started off in a little space. We started with one doctor and one health coach, which was you, and one nutritionist and one nurse, and that was our team. We've gone from 6 people to over 50 people, and have really developed a model that's now integrating into the rest of Cleveland Clinic. We're having physicians refer in patients to us, where we've developed the shared medical appointment group model, which is very powerful, getting people to change their behavior. It's a lifestyle change program. It's based on functional medicine, and now we're the #1 in group visits in the entire organization. And put that in perspective, the #2 is a group that has over 300 physicians. We have like 6.
Wow.
And we're #1.
That's amazing.
And I think it is pretty striking, and it speaks to the incredible demand we saw, where we had up to 3,000 people on our waiting list.
Yeah.
And as we started to grow, as we started to raise money for research, the leadership here felt it was important to give us a premier space, and they gave us this incredible space here, which is a very coveted space.
Very coveted, yeah. It was controversial.
It was. We made a lot of enemies because people wanted the space, and we got it. And it's been all done in an environmentally friendly way. Clean air, the carpets, the materials with no off-gassing, the water is especially filtered. It's got the cleanest water in Cleveland.
Good to know, yeah. And so that's it. So there's so much that's happened in 5 years. Yeah. And in 2014, I remember you saying, after, the first few months, that it was like, wow, it's really growing so quickly through word of mouth solely. Like, there was no marketing. Mm-hmm. We weren't really allowed to do interviews anywhere because they didn't want there to be more of a demand that that we weren't able to handle. Yeah. And so it was strictly, I think, through word of mouth, because every patient that I would see, I'd be like, how did you hear about us? And it was like, oh, well, I work with this person, and they were losing weight and feeling so much better, and I asked, what are they doing, Right. So it's really amazing. And I think that from a research standpoint, that was another huge thing with coming here, right, was to
we want to create the evidence base for functional medicine, because up to now there's been no money for it. We raised about $15 million. We got money from the organization to fund research, and we're doing randomized trials in asthma, diabetes. We're launching 2 new trials in Crohn's disease and early dementia. We're looking at cost of care. We're looking at our shared medical appointments. We're looking at a rheumatology comparison. How do we compare to the rheumatology group? And we trying to get that published now. It's in a manuscript form, and we found that we do better than even the best rheumatologists here in helping with pain and quality of life and symptoms. Same thing, comparing us to a big family practice group within the clinic. We do better in outcomes across the board and physical and mental measures. So we're seeing the value of what we're doing, and I think that's really helping to kind of move things forward. So we're going to continue to publish, continue to get data out there, and it's really a key part of our strategy.
Yes, because you've been practicing functional medicine for how many years?
25 years.
25 years, and it's like you saw the evidence in front of you, but it wasn't necessarily converting to publications in order to really leverage, okay, no, this actually works.
Well, the pieces were in the research. So we knew about the role of omega-3s, or the role of folate, or the role of vitamin D, or the role of a diet, or the role of like high-carb sugar diets on health. So we actually put together an overall framework for treating patients based on the research. But what's not been done is studying the system as a whole, which is applying the model of functional medicine systematically and measuring that. And that's what we're doing now.
Yeah, and randomized control trials that the intervention group is seeing their specialist at the Cleveland Clinic, and then the intervention group is seeing functional medicine plus their physician. So cool. Okay, awesome. So then, of all of the things that you've done, which are a lot, what would you say is the most significant to you?
Well, so many things. So many things. I mean, the things that have really, been really powerful and moving for me, I would say, are probably, three things that have sort of led to all the work I'm doing. One is getting sick myself and having to figure out what's wrong, 25 plus years ago, and heal myself. Discovering the model of functional medicine changed the trajectory of my life. It made me passionate about the topic. It made me want to study it intensively. It made me want to learn how to heal myself, heal my patients, and to advance the cause of functional medicine in the world. So that's been a key facilitator, and that was really by going into the biology, like what is the sort of nitty-gritty science around how our bodies work, right?
Yeah, but I think the thing, let me just interrupt for 1 second, I think that the thing that's so unique about you, just from what I've observed in the last 5 years, is that you also are a visionary. So you're able to take that nitty-gritty, and then you're able to apply it to the vision that you have for, like, this is what we need in order to make the most of what we know on this nitty-gritty detail level.
I was really driven out of, my own suffering and the suffering I saw in my patients, and the fact that I thought this was the biggest kept secret in medicine and the biggest discovery since the internet. And yet nobody was talking about it, and that made me mad. It made me see so many people suffering. It just broke my heart, and I knew that there was a way for people to get better. They just weren't getting access to it, and that's what drove me for the last 25 years to be out there telling the story.
Yeah.
The second thing was, it's kind of related to the third thing, was I went to Haiti after the earthquake, and it wasn't something I planned. The earthquake happened. I had the opportunity to go, and I got to really see how a model of care worked that was fundamentally different for health. It wasn't really related to the earthquake directly, but it was Paul Farmer, who I met, who was a doctor from Harvard who went to Haiti and figured out how to cure TB and AIDS in this poor country using the power of community and community health workers, what he called accompaniment. And then as a result of that, I began to understand that chronic disease, I was working in my office with people one-on-one, but I realized a lot of the causes of their disease were things that were outside of a clinic or a hospital or just a medical test. It was about their home environment, about the food they ate, about their stress levels, about we call the social determinants of health. And so the question is, then how do you change people's behavior? And that's what Paul Farmer did in Haiti, was he figured out how to deal with what he called structural violence, the social, the economic, and the political conditions that drive disease.
Yeah.
And so as I began to sort of think about how this applied to chronic illness, it was really clear to me that chronic disease was also contagious.
Exactly.
And that health is also contagious, on the other hand. So people can get healthy together, they also get sick together. We know that people are more likely to be overweight if their friend's overweight than if their family's overweight. That our zip code is a bigger determinant of our health outcomes than our genetic code.
Right.
So that's a big statistic.
It's huge, yeah.
And so then I began to think about this, and I met a guy named Rick Warren, who was from Saddleback Church, a big pastor in Southern California. And he I said, why don't we put a healthy living program in your church? Because he had all these small groups. And I thought we could use the power of community and peer support, and where people can support each other, hold each other accountable, be there when things are hard, encourage each other. And I said, why don't we just do an experiment? So we did a social experiment in his church, and it was remarkably effective. I mean, it was 15,000 people signed up. They lost 250,000 pounds. And I realized that we need to combine both the science of how to create health from the biology point of view with the science of behavior change, and put those two together. And the solution really is the power of community, the power of, I call it friend power, not willpower. And I think we're seeing that now being very effective here at Cleveland Clinic. So when I got here, my original thinking was I want everybody in a 12-week group. No one can see a doctor or provider until they go through a basic fundamental lifestyle change program, which is based on functional medicine. Well, we couldn't get that going. There was no way to pay for it. It was complicated. We finally figured out a model called a shared medical appointment, which is...
But even before that, I think that the other unique thing that you've done at the UltraWellness Center and that you brought to the Cleveland Clinic is that for every patient, before the group models existed, for every patient that saw a doctor, they had to see a dietitian and a health coach, because it was this very coordinated model of care that helped people to get well.
I mean, well, the idea is if food is medicine, then how as a physician can I treat my patients if I can't use the main medicine, which is food? And I implemented in my practice 15 years ago when I started it at Canyon Ranch before that there was no way you could get an appointment with a doctor unless you agreed to see a nutritionist. And we've implemented that here at Cleveland Clinic, and I think we're probably the only two places in the country or the world where that policy exists.
Yeah, you're right. I agree with that.
And I think it's not an add-on or a nice to or a feel-good thing. It's actually an essential part of care.
Right.
So I think that's a huge factor. And then the groups, really, the nutritionists, the health coaches, the doctors, nurse practitioners, PAs, they all work with a group over a 10-week period, 2 hours a week, and we find the outcomes are often even better than one-on-one visits. And that half the people who go through the groups don't even need to go get further care because they're just better.
Yeah. I remember when I was leading one of the weight loss classes at the Cleveland Clinic, and you had come into one of the classes that I was teaching just to pop your head in and see everyone. No, it was before even Functioning for Life existed. It was because before Functioning for Life existed, we started the weight
program.
Well, yeah, I did the diabetes program at one of the satellite hospitals. That was amazing because they were resistant diabetics. They were resistant to their medication and their insulin, and then their hemoglobin A1C went down so quickly. I mean, their blood sugar was going down so quickly that they couldn't even get in fast enough with their endocrinologist to adjust their medication. But I was referring to the weight loss classes that we had set up before Functioning for Life for the employees at the Cleveland Clinic, because that came first, and that was just the 8-week coordinated nutrition appointments. And you popped your head in, and you were like, most of you, if you just address food, you think that all these problems are related to things that you need to be talking to your doctor about, but most of them have to do with food. Whether you're working out and whether you're eating well, and obviously other factors like stress and those kinds of things. But it was, after you left the room, they were amazed that it was this complete change. They've never heard a doctor say something like that, and they're like, wow, he's so amazing.
Well, it's just, when you start to understand the power of food as medicine, everything changes. Because it's not like, oh, eat better so you lose weight. It's literally a drug. So eating the wrong drugs have a lot of bad side effects, right? Eating processed food and sugar and refined oils and junk food, it causes all the wrong signals to be turned on in your body. When you eat the right food, it literally acts as a drug. It regulates your gene expression, your hormones, your brain chemistry, your immune system, all your protein functions, even your gut microbiome are all regulated by the food you eat. And so when you begin to understand that, it's like, whoa, food isn't just calories, it's information. It actually helps to regulate all these things. And I realize that if I do put in the right information, then my body wants to be healthy.
Right.
So for example, I was on the road a lot in June. I was very busy, and often it's sometimes hard to get the best food, and I was a little sluggish. I gained a little weight, and I just went home and I just went back to cooking real food myself, ate tons of vegetables, played tennis. I wasn't trying to lose weight, but I almost instantly got back to perfect. And
just kidding.
For a 60-year-old, as perfect as you can get.
You look very good.
Below the neck. I'm good. Got gray hair above the neck. So, But it's powerful when you see how simple it is.
Yeah.
You know, and I was eating a lot. I wasn't like starving myself, and I was actually just eating the right things.
Yeah. Okay, so I derailed us. So the third thing you were going to say, this you went through the first two.
Those are the third. So the church experience, and then the Haiti experience, which are connected. Those are 2 and 3. So those two really impacted me because one, Haiti just kind of got me alert to this issue.
Yeah.
And then the church was an actual experience of how this could be implemented, and I began to realize that health doesn't happen in the doctor's office. Health doesn't happen in the hospital. It happens in your home. It happens in your kitchen. It happens where you work, where you go to school,
Right.
where you hang out, where your friends are. That's where health happens, and we're focused on the wrong end of the problem if we're trying to go to the doctor, get a pill, and think we're going to be healthy. It doesn't work like that.
Agreed. Yeah. This is where you're a big visionary, though, that I have said. Okay, so let's move on to, you were talking about your own, like, being on the road and then gaining weight and not eating as well. So I'm interested for all the people that are traveling and so busy. This is something that I hear all the time from people that I work with, that it's like, oh, it's too hard. What are things that you do, since you're back and forth between Cleveland and New York and, like, everywhere else in between and even further outside of that? What do you do in order to maintain your health that are, like, non-negotiables?
I go to TownHall when I'm in Cleveland. Which is the ultimate vegan restaurant.
Yeah, which is where we always run into each
vegan.
other.
I'm like, yeah, I could have designed this restaurant. No, I'm pretty good. There are periods where it's a little more difficult, but when I'm at home, I'm really good. I wake up, I meditate, I sometimes eat breakfast, sometimes I do intermittent fasting, and I usually exercise an hour a day, whether it's weights or spiking or swimming or playing tennis.
Yeah.
And when I'm on the road, for example, when I'm here in Cleveland, I know how to hunt and gather. So I've sort of surveyed the landscape of food in my circle, and most of us live in a circle. Like we live at home, work, whatever.
Yeah.
Like we live in a circle. So you have to learn where in that, savanna you're going to find the right roots and animals to eat, essentially, right?
Right.
So how do you be a good hunter-gatherer? So I know, for example, in the airports where I go to, where I can buy snacks or nuts, or there's some of this healthier stuff now in airports, so I buy my snacks. Or I always bring with me an emergency food pack. So I literally probably have a day's worth of food in my backpack all the time. So it could be buffalo bison bars, it could be packets of nut butter, it could be bags of nuts. I don't have too many different kinds of bars because I don't like bars, but I think there are whole food bars, like Hyman bars are pretty good if you get in a pinch. So I never have to be in an airplane or an airport or get stuck. And sometimes I'll have beef jerky in my bag. So if I don't get dinner, I'll just have a bag of beef jerky and I'll have some nuts. And
Yeah, no.
so like I don't let myself go, I'm just going to eat some crap in the airport because there's nothing else to eat.
Yeah.
And like when I'm in town, I'll often sort of look at my week and I plan. Like I go, I know where every day what I'm doing for my food. I know where I'm eating breakfast, lunch, dinner. I think about it in advance. I kind of navigate how I'm going to do it. If I'm busy, like today I was in a meeting and back to back to back. So I had my assistant, I gave her my credit card, I ordered the food from the restaurant, and I got, some healthy salad, a soup.
Yeah.
Really easy, and I'm lucky I got someone to help me that. But, you just have to think about it in advance.
Right.
And now there's, all kinds of apps, like there's, Postmates and, delivery apps, and we use Caviar in New York, which is kind of fun. My wife likes that. but it's all these restaurants, and
No, it's
so
true.
there's a way you can actually start, but you have to plan about it. And then exercise, so like I check out what's available. So I did yoga on Monday. went to the hot yoga class. I knew it was at 7 o'clock. I could finish work and go there. And I already knew the restaurant that was good. That was next door. There was an Italian restaurant where they have great fish and protein and lots of veggies. I ordered a huge pot of veggies. Yeah. So I think you just have to learn how, when you in your scope of where you go, how to navigate. And then I meditate, so I make sure, like yesterday I was going to an event to speak last night, and I had a very busy day. But
every day is so busy for you.
Yeah, but then I meditated for 20 minutes in the car on the ride over, and I got there, I was refreshed, I was grounded, and was able to give a talk.
Yeah, amazing.
Yeah.
So if you can do it, really anyone can do it.
Yeah, tonight and today I'm going boom, 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 back to back all day from 7 o'clock in the morning, and I know that I'm going to meditate in the car on the way to the airport. So I just learned, and then I have a 7-minute workout I can do if I get stuck somewhere. So I'm very focused on designing my life so that I build in basic maintenance stuff when I'm just trying to get by.
Yeah.
And then when I'm home, it's much easier because I'm in control of the food I eat and my activities and so forth.
Okay, awesome. Yeah, my like number one memory of you is just like sitting with your nut butter packet, like eating it in between patients as
Like
we're
a
trying to
little
talk about
squirrel?
the patient. It's like, what?
A little squirrel, yeah.
Okay, so then the other question that so many people ask me is, do you ever eat sugar or a piece of bread? I know that you like really walk the talk when it comes to adhering to your vegan diet, and you'll sort out the places to go. You go to TownHall, you go to other restaurants that have the protein and veggies to keep yourself on track.
Yeah.
But do you ever eat things that are off of the vegan diet?
Well, no, because the vegan diet is inclusive of everything, right? It doesn't include things that aren't food, right? So you're never going to see me eating a Twinkie or a Chips Ohio cookie or a Snickers bar.
But it doesn't
or
include
Skittles.
gluten, so that would
No, it does. It
encompass
says
under bread.
it's right, but it says be aware of gluten, right? So like when I eat gluten, it might be barley or rye, or it might be heirloom wheat, or it might be certain types of bread that are fermented differently and or come from other countries, right? Because the wheat in this country is a problem.
Yeah.
So I will. I'm not gluten sensitive, so it doesn't bother me. But I really minimize it, and like occasionally, like the other night, my wife was like, she really wanted pasta, and we were in the store, and there was like these fresh tomatoes, and they had this ribbon, colorful pasta from Italy that was dyed with squid ink and different herbs, and it was like the most beautiful thing. So I'm like, all right, I'll make something. So I made basically a little bit of pasta, and then made this amazing, I call it deconstructed pesto pasta. So it's like fresh tomatoes that are all like kind of ripe, and then tons of basil, pine nuts, garlic, olive oil, and salt and pepper, and mix the pasta in there. It's just the most amazing thing.
Yeah, you're also a very good cook,
Yeah.
I will say.
So
You're
I like to cook. I like
amazing
to cook.
in the kitchen.
I love to cook, and I love to just be creative, and I don't usually use recipes, even though I've written 5 cookbooks. My new cookbook's coming out in October.
Yeah, so
It's called-
what should we look for that's coming out with projects, books?
Yeah, well, a couple things. One, I got a cookbook called Food, What the Heck Should I Cook? It's coming out in October, in the fall of 2019. And I got another book, which is about fixing the food system, called Food Fix, How to Save Our Health, Our Economy, Our Communities, and Our Planet One Bite at a Time, coming out in February of 2020.
Okay.
I've got my Doctor's Pharmacy podcast,
Yes.
which is pretty awesome.
That they can find at drhyman.com, or is there a website for
They can go to
Dr.
drhyman.com, they can go to Dr. Hyman Podcast, and they'll find it. It's on iTunes, Google Play, Spotify, wherever you get your podcasts. And that's really, my weekly contribution, and I think it's a great place where people have conversations that matter about things people care about.
Yeah. Well, thank you so much for letting us interview you. Thank you for all of the work that you're doing to really move our healthcare system forward. Thank you for training people like me, because I
Still a work in
am
progress.
indebted to you.
Still a work in progress.
But you're doing amazing things, so thank you for
Brigid.
everything.